Good day, my name is Frank Louis R. Patigas from BSN2 Wedenbach, and today I'm going to perform Lupul's maneuver. Lupul's maneuver are a systemic method of observation and palpation to determine fetal position, presentation, and the expected location of the point of maximal intensity of fetal heart rate in the woman's abdomen. It is performed after 24 weeks gestation when fetal outline can be palpated. Before we start, we must first wash our hands. Hand washing prevents the spreading of pathogenic microorganisms, and then provide clients privacy. Good morning, ma'am. I'm Frank Louis Patigas, your student nurse for today. May I know your name, ma'am?
My name is Catriona.
Okay, Mrs. Catriona, I'm going to perform Lupul's maneuver to determine the position of the baby. Would you like to go to the restroom before we start because it might be uncomfortable for you during palpation? Okay. The first thing that we are going to do is position the mother in dorsal recumbent. This helps the clients relax her abdominal muscles to enhance palpation. Ma'am? Next is expose only the part near for the procedure to provide clients privacy. Ma'am. Next is warm hands first by rubbing it together to provide comfort to the client's abdomen. First maneuver, fundal grip. We must first stand at the foot of the client, facing the client, using both hands, feel for the fetal part lying in the fundus. Proper positioning of hands ensures accurate findings. Next, palpate the superior surface of the fundus. Determine the consistency, shape, and mobility. To determine what position of the fetus lies in the fundus, head feels round and hard, freely movable and ballotable. Breech feels large, nodular, and softer. Second maneuver, umbilical grip. Face the client and place the palms of your hands on both sides of the abdomen, like this. Proper positioning of hands ensures accurate findings. Palpate the sides of uterus, with left palm stationary on the left side of the abdomen to steady the uterus. The right palpates the right side of the uterus on a circular motion from top to lower segment of the uterus, applying gentle but deep pressure to palpate the fetal outline and small fetal parts. On both sides. To determine which direction the fetal head is facing. If one hand feels a smooth, hard, long, continuous structure, it is the back. If the other hand feels the nodular angulations, it is the extremities of the fetus. Third maneuver, Pollick's grip. Your finger must be an L shape, like this. Gently grasp the lower portion of the abdomen just above the symphysis pubis, between the thumb and index finger, and try to press the thumb and your index finger together. This. Determines the presenting part and its mobility. If the presenting part moves upward, so an examiner's hands can be pressed together, the presenting part is engages. The fourth and final maneuver is the pelvic grip. So now I'm going to turn around. Before we were facing the mother's face. So now I'm going to face the feet of the mother. Place one hand each on either side of the lower pole of the uterus, like this. So now, palpate the fetal head by pressing downward about 2 inches above the inguinal ligament. This. Use both hands. This maneuver determines fetal attitude and degree of fetal extension into the pelvis. This should be done only if fetus is in cephalic position. Cephalic position is when the head of the baby is in the pelvis area. So now we are done in Leopold's maneuver. I am placing now my client in a comfortable position to ensure the safety and comfort. Ma'am. So that's it. Don't forget to document your findings and assessment of your client. And lastly, wash your hands. And that's all. And thank you for watching.